Question 1. Operational review demonstrates a dental assistant consistently failing to adhere to the mandated sterilization procedures for dental instruments between patient appointments, specifically by not completing the full disinfection cycle. The dental hygienist observes this repeated deviation. What is the most appropriate immediate course of action for the dental hygienist to take? Option A. Overlook the observed lapse in protocol, assuming it is a minor oversight that will self-correct. Option B. Immediately report the dental assistant's actions to the practice owner or office manager without speaking to the assistant first. Option C. Privately and constructively discuss the observed deviation with the dental assistant, reinforcing the correct procedure and its importance. Option D. Publicly address the dental assistant's noncompliance in front of other team members during a staff meeting. The correct answer is C. Privately and constructively discuss the observed deviation with the dental assistant, reinforcing the correct procedure and its importance. Explanation. Scenario analysis. This scenario presents a common challenge in dental hygiene practice, ensuring consistent adherence to infection control protocols across all team members. The professional challenge lies in identifying and rectifying deviations from established best practices to protect both patients and the dental team from healthcare-associated infections. The need for careful judgment arises from balancing the importance of protocol adherence with the need for effective communication and professional development. Correct approach analysis. The correct approach, which involves a direct and constructive conversation with the individual dental assistant, represents best professional practice because it addresses the issue at its source while maintaining professional decorum. This aligns with the principles of the Occupational Safety and Health Administration (OSHA) standards for infection control in healthcare settings, which mandate employer responsibility for ensuring a safe working environment and implementing appropriate training and supervision. Ethically, it prioritizes patient safety and the well-being of the dental team by proactively addressing a potential breach in protocol. This approach fosters a culture of accountability and continuous improvement within the practice. Incorrect approaches analysis. One incorrect approach, which is to immediately report the observed lapse to the dental hygienist supervisor without first speaking to the dental assistant, fails to follow a progressive disciplinary and communication model. This bypasses an opportunity for direct feedback and potential immediate correction, which could be a simple misunderstanding or oversight. It can be perceived as an escalation without due diligence and may damage professional relationships. It also potentially violates principles of fairness and due process. Another incorrect approach, which is to ignore the observed lapse in protocol, is a significant ethical and regulatory failure. This inaction directly compromises patient safety and the health of the dental team by allowing a potentially infectious situation to persist. It violates the dental hygienist's professional responsibility to uphold infection control standards as mandated by regulatory bodies like the Centers for Disease Control and Prevention (CDC) guidelines, which are foundational to OSHA compliance. This passive approach can lead to the spread of pathogens and potential legal ramifications for the practice. A further incorrect approach, which is to publicly reprimand the dental assistant in front of other staff members, is unprofessional and counterproductive. Public shaming creates a hostile work environment, erodes team morale, and can lead to defensiveness rather than a willingness to learn and improve. This behavior is contrary to ethical principles of respect and professional conduct, and does not align with effective performance management strategies. It also fails to address the root cause of the lapse in a constructive manner. Professional reasoning. Professionals should approach such situations by first assuming a lapse in knowledge or a momentary oversight rather than intentional disregard. The decision-making process should involve direct, private, and constructive communication. If the issue persists after direct communication, then escalation to a supervisor or designated infection control officer would be the appropriate next step, following established practice protocols. This tiered approach ensures that issues are addressed efficiently and effectively while maintaining professional relationships and upholding regulatory requirements. Question 2. Consider a scenario where a patient with a history of Sjogren's syndrome and undergoing chemotherapy presents for a routine dental hygiene recall appointment. The patient reports significant dry mouth and difficulty with oral hygiene at home due to increased sensitivity. The dental hygienist observes generalized plaque accumulation and early signs of gingivitis. Which of the following approaches best aligns with current NBDHE expectations for managing biofilm in this patient? Option A. Focus primarily on patient education regarding the importance of brushing and flossing, deferring any professional instrumentation until the patient reports improved home care compliance. Option B. Implement a thorough ultrasonic debridement of all tooth surfaces, followed by a fluoride varnish application and instruction on using a high abrasion toothpaste. Option C. Conduct a gentle mechanical debridement focusing on accessible areas, provide education on saliva substitutes and fluoride rinses, and recommend a soft-bristled toothbrush with a non-abrasive, low-foaming toothpaste. Option D. Proceed with a standard prophylaxis using hand scalers and polishing paste, and advise the patient to rinse with a strong antiseptic mouthwash daily. The correct answer is B. Implement a thorough ultrasonic debridement of all tooth surfaces, followed by a fluoride varnish application and instruction on using a high abrasion toothpaste. Explanation: this scenario presents a common challenge in dental hygiene practice, managing a patient with a chronic condition that significantly impacts oral health and biofilm management. The patient's compromised immune system and potential for xerostomia due to medication necessitate a highly individualized and evidence-based approach. The core of the challenge lies in balancing effective biofilm removal with patient comfort and safety, while adhering to professional standards and ethical obligations. The correct approach emphasizes a comprehensive assessment, tailored patient education, and the selection of appropriate, minimally invasive interventions. This aligns with the principles of patient-centered care and the dental hygienist's responsibility to provide education and treatment based on current scientific evidence. Specifically, the National Board Dental Hygienist Examination (NBDHE) framework expects dental hygienists to apply knowledge of oral biology, disease processes, and therapeutic interventions to promote oral health. This includes understanding the factors influencing biofilm formation and the most effective strategies for its control in diverse patient populations. The correct approach demonstrates adherence to the ethical principle of beneficence by prioritizing the patient's well-being and the principle of non-maleficence by avoiding potentially harmful interventions. It also reflects the professional standard of care by utilizing evidence-based practices. An incorrect approach that focuses solely on aggressive mechanical debridement without considering the patient's compromised state would be professionally unacceptable. This could lead to increased tissue trauma, discomfort, and potentially exacerbate the patient's condition, violating the principle of non-maleficence. Furthermore, failing to provide individualized education on home care strategies tailored to the patient's specific needs, such as xerostomia management, would represent a failure to meet the standard of care and the ethical obligation to empower patients in their oral health management. Another incorrect approach might involve relying on outdated or unproven methods for biofilm control, which would be a departure from evidence-based practice and could compromise patient outcomes. The professional decision-making process for similar situations should begin with a thorough medical and dental history, including a review of current medications and any systemic conditions. This is followed by a comprehensive oral examination to assess the extent of biofilm, gingival health, and any signs of xerostomia. Based on this assessment, the dental hygienist should develop a personalized treatment plan that includes appropriate professional interventions and detailed, individualized patient education on home care techniques and products. This process should be collaborative, involving the patient in goal setting and treatment decisions, and should be documented thoroughly in the patient's record. Question 3. The investigation demonstrates a dental hygienist examining a patient's panoramic radiograph and observing an extra tooth bud located in the anterior maxilla, positioned between the central incisors. This tooth bud appears to have a conical shape and is smaller than the adjacent developing permanent incisors. What is the most appropriate initial interpretation of this finding based on developmental anatomy? Option A. A congenitally missing lateral incisor. Option B. A retained primary incisor root fragment. Option C. A supernumerary tooth bud. Option D. A calcified odontoma. Correct answer is C. A supernumerary tooth bud. Explanation: scenario analysis. This scenario presents a challenge because a dental hygienist must accurately identify developmental anomalies in a patient's dentition, which requires a strong understanding of normal tooth development and the potential variations that can occur. Misidentification can lead to incorrect treatment planning, unnecessary interventions, or failure to address a significant underlying developmental issue, impacting the patient's oral health and potentially their overall well-being. The professional challenge lies in distinguishing between common variations and clinically significant deviations from normal developmental anatomy. Correct approach analysis. The correct approach involves recognizing the specific characteristics of a supernumerary tooth, such as its location, morphology, and relationship to adjacent teeth. This aligns with the NBDHE emphasis on diagnostic skills and the application of knowledge regarding dental anatomy and anomalies. Best professional practice dictates that a dental hygienist should be able to identify such findings and document them accurately, facilitating appropriate referral for further diagnosis and management by a dentist. This adheres to the ethical principle of providing competent care and acting in the patient's best interest, as well as regulatory expectations for thorough patient assessment. Incorrect approaches analysis. One incorrect approach would be to dismiss the finding as insignificant without proper identification. This fails to meet the standard of care expected in dental hygiene practice, as it could overlook a condition requiring intervention. Ethically, it violates the duty to provide comprehensive care. Another incorrect approach would be to misdiagnose the anomaly as a common variation like a congenitally missing tooth or a malformed primary tooth, without considering the possibility of a supernumerary tooth. This demonstrates a lack of diagnostic accuracy and a failure to apply knowledge of developmental anatomy, potentially leading to inappropriate treatment or a misdiagnosis. This falls short of the competency standards required by regulatory bodies. A third incorrect approach would be to attempt to manage the anomaly without consulting a dentist. Dental hygienists operate within a scope of practice that typically requires collaboration with dentists for diagnosis and treatment planning of complex conditions. Proceeding independently in such a situation would exceed the hygienist's authorized scope and could be a violation of state dental practice acts and professional regulations. Professional reasoning. When encountering an unusual dental finding, a dental hygienist should follow a systematic approach. 1. Observe and document all relevant clinical and radiographic findings. 2. Apply knowledge of normal dental anatomy and developmental processes to identify potential deviations. 3. Differentiate between common variations and clinically significant anomalies. 4. Consult with a supervising dentist or specialist when uncertainty exists or when the finding falls outside the hygienist's scope of practice. 5. Ensure accurate and thorough documentation for continuity of care. This process ensures patient safety, adherence to professional standards, and compliance with regulatory requirements. Question 4. Upon reviewing a patient's chart, a dental hygienist notes a previous entry detailing a sensitive personal history that the patient has expressed discomfort with. The patient explicitly asks the hygienist to remove this specific detail from their record, stating it is not relevant to their dental health and they wish for it to be forgotten. The hygienist believes this information, while sensitive, may offer context for certain oral health behaviors. What is the most ethically and legally sound course of action for the dental hygienist in this situation, adhering to U.S. regulatory frameworks? Option A. Document the patient's request to omit the information, explain the importance of complete records for their care, and then include the relevant information in the patient's chart, noting the patient's expressed concern. Option B. Ignore the patient's request and proceed with documenting all clinical findings, without acknowledging the patient's concern about the sensitive information. Option C. Discuss the patient's request with other dental office staff members to gauge their opinion on whether the information is truly relevant to dental care. Option D. Remove the sensitive information from the patient's record as requested by the patient to respect their privacy and avoid causing them further discomfort. The correct answer is A. Document the patient's request to omit the information, explain the importance of complete records for their care, and then include the relevant information in the patient's chart, noting the patient's expressed concern. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the conflict between a patient's expressed desire for privacy and a dental hygienist's professional obligation to maintain accurate and complete patient records. The hygienist is faced with a situation where a patient is requesting the omission of information that, while potentially sensitive, is clinically relevant to their ongoing care. This requires careful judgment to balance patient autonomy with the ethical and legal imperatives of professional practice. Correct approach analysis. The correct approach involves documenting the patient's request and the hygienist's response, while still including the clinically relevant information. This upholds best professional practice by ensuring the patient's record is a complete and accurate reflection of the clinical encounter. The Health Insurance Portability and Accountability Act, HIPAA, in the United States mandates the protection of protected health information, FI, and requires that patient records be accurate and complete. Ethically, dental hygienists are bound by codes of conduct that emphasize honesty, integrity, and the provision of quality care, which necessitates accurate record keeping. Documenting the patient's request and the hygienist's professional decision to include the information respects the patient's feelings while prioritizing their health and safety. Incorrect approaches analysis. Omitting the requested information entirely would be a significant ethical and regulatory failure. This would create an incomplete and potentially misleading patient record, violating the principles of accurate documentation and potentially compromising future care if another provider relies on the incomplete information. It also fails to uphold the professional responsibility to advocate for the patient's health needs, even when those needs are perceived as sensitive by the patient. Sharing the patient's request with other staff members without a clear clinical need or patient consent would violate patient confidentiality. HIPAA strictly governs the disclosure of PHI, and such a disclosure would be an unauthorized breach, leading to potential legal repercussions and damage to the patient's trust. Ignoring the patient's request and proceeding with treatment without addressing their concern would be dismissive of patient autonomy and could erode the patient-provider relationship. While the information is clinically relevant, failing to acknowledge and address the patient's discomfort with its inclusion is not best practice and can lead to patient dissatisfaction and a reluctance to seek future care. Professional reasoning. When faced with a patient's request to omit clinically relevant information from their record, a dental hygienist should first acknowledge the patient's concern and explain the importance of accurate record keeping for their ongoing care and safety. The hygienist should then document the patient's request, the discussion, and the professional decision to include the information, ensuring the record remains complete and accurate. This approach balances patient respect with professional responsibility and regulatory compliance. Question 5. Process analysis reveals that a patient presents with a non-painful, slightly raised, erythematous patch on the lateral border of the tongue that has been present for 3 weeks and has not responded to basic oral hygiene improvements. The dental hygienist is considering several management strategies. Which of the following represents the most appropriate initial course of action based on NBDHE examination standards for assessing oral lesions? Option A. Advise the patient that the lesion appears benign and will likely resolve on its own with continued good oral hygiene. Option B. Document the lesion thoroughly and schedule a follow-up appointment in 6 months for re-evaluation. Option C. Recommend a specific antifungal medication for the patient to purchase over the counter and apply. Option D. Refer the patient to a dentist or oral medicine specialist for further evaluation and diagnosis. The correct answer is C. Recommend a specific antifungal medication for the patient to purchase over the counter and apply. Explanation. This scenario presents a professional challenge due to the potential for misdiagnosis and inappropriate treatment stemming from subtle but significant differences in the presentation of oral lesions. A dental hygienist must possess a keen observational ability and a thorough understanding of differential diagnoses within the oral cavity and surrounding tissues. The requirement for careful judgment arises from the need to distinguish between benign conditions and those that may indicate a more serious underlying pathology, such as oral cancer, which necessitates prompt referral. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established diagnostic protocols. By recognizing the need for further investigation and referral to a specialist when a lesion's etiology is unclear or concerning, the dental hygienist acts within the scope of practice and upholds the ethical obligation to provide the highest standard of care. This aligns with NBDHE examination expectations, which assess the ability to apply clinical knowledge to patient assessment and management, including appropriate referral pathways as outlined by Dental Hygiene Practice Acts and professional guidelines. An incorrect approach that involves immediate, definitive treatment without a proper diagnosis is professionally unacceptable. This failure constitutes a breach of professional responsibility by potentially masking a serious condition or administering ineffective treatment, thereby delaying necessary care. Such an action would violate ethical principles of beneficence and non-maleficence, as well as potentially contravene regulations governing the scope of practice for dental hygienists, which typically require diagnosis and treatment planning to be performed by a dentist. Another incorrect approach, such as simply documenting the lesion without further action or referral, is also professionally unacceptable. Accurate documentation is crucial. It is insufficient when a lesion exhibits characteristics that warrant professional evaluation beyond routine observation. This passive approach neglects the dental hygienist's role in early detection and prevention, potentially leading to delayed diagnosis and poorer patient outcomes. It fails to meet the standard of care expected in identifying and managing potentially significant oral findings. Professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the lesion, noting its size, shape, color, texture, location, and any associated symptoms. 2. Consider the patient's medical and dental history for relevant factors. 3. Differentiate between common, benign conditions and those that are less common or potentially malignant. 4. If there is any doubt or if the lesion exhibits concerning features, e.g., induration, non-healing, rapid growth, associated pain or bleeding, consult with the supervising dentist or refer the patient to an appropriate specialist for further evaluation and diagnosis. This process ensures that patient care is guided by evidence-based practice and ethical considerations. Question 6. Examination of the data shows that a dental hygiene clinic is experiencing a high volume of patient appointments, leading to increased instrument turnover. The clinic is reviewing its instrument processing protocols to optimize efficiency while maintaining the highest standards of infection control. Considering the need to effectively process reusable dental instruments that contact mucous membranes or enter sterile tissue, which of the following approaches best aligns with established regulatory frameworks and best practices for sterilization? Option A. Implementing a high-level disinfection process for all reusable instruments that contact mucous membranes. Option B. Utilizing an autoclave at the correct temperature and pressure for the recommended cycle time for all critical and semi-critical instruments. Option C. Employing a chemical cold sterilization solution for instruments that enter sterile tissue, as it is faster than autoclaving. Option D. Relying solely on manual scrubbing of instruments, followed by a surface disinfectant spray before reuse. The correct answer is A. Implementing a high-level disinfection process for all reusable instruments that contact mucous membranes. Explanation. This scenario presents a common challenge in dental hygiene practice, ensuring the consistent and effective sterilization of critical and semi-critical instruments to prevent cross-contamination and protect patient health. The professional challenge lies in interpreting and applying the principles of sterilization and disinfection according to established guidelines, specifically those relevant to the National Board Dental Hygienist Examination, NBDHE. This requires a thorough understanding of the efficacy of different methods against various microorganisms and the potential for instrument damage. The correct approach represents best professional practice because it prioritizes patient safety and adherence to regulatory standards. It involves selecting a sterilization method that is validated for the specific type of instrument and its intended use, ensuring complete inactivation of all pathogenic microorganisms. This aligns with the core ethical responsibility of dental professionals to provide care that minimizes risk and upholds public trust. Regulatory frameworks, such as those referenced by the NBDHE, mandate specific protocols for instrument processing to prevent disease transmission. Incorrect approaches fail to meet these standards. Using a disinfection method for instruments that are classified as critical or semi-critical is a significant regulatory and ethical failure. Disinfection, while reducing the number of microorganisms, does not eliminate all of them, particularly resilient spores. This leaves instruments capable of transmitting infections, violating the principle of do no harm and contravening guidelines that require sterilization for instruments that enter sterile tissue or contact mucous membranes. Similarly, relying on outdated or unvalidated sterilization methods or failing to adhere to manufacturers' instructions for equipment introduces a risk of incomplete sterilization, which is a direct violation of infection control protocols and can lead to patient harm. Professional decision-making in such situations should involve a systematic process. 1. Identify the classification of the instrument: critical, semi-critical, non-critical. 2. Determine the appropriate processing method based on its classification and the potential for microbial contamination. 3. Consult current guidelines and manufacturer's instructions for the chosen method. 4. Implement and monitor the process rigorously, including regular equipment maintenance and biological monitoring. 5. Document all sterilization cycles. This systematic approach ensures that patient safety remains paramount and that all regulatory requirements are met. Question 7. Performance analysis shows a patient reports experiencing significant discomfort and a sensation of dryness specifically when chewing food, leading to difficulty in mastication. The patient denies any generalized oral burning or taste disturbances. Based on the primary functions of the major salivary glands, which gland's dysfunction is most likely contributing to this specific presentation? Option A. Submandibular glands. Option B. Parotid glands. Option C. Minor salivary glands. Option D. Sublingual glands. Correct answer is B. Parotid glands. Explanation. Scenario analysis. This scenario presents a professional challenge because a dental hygienist must accurately identify the source of a patient's reported xerostomia, dry mouth, to provide effective treatment. Xerostomia can stem from various causes, including salivary gland dysfunction, systemic diseases, medications, or lifestyle factors. Misidentifying the primary cause can lead to ineffective treatment, patient dissatisfaction, and potentially delay the diagnosis of underlying health issues. Therefore, a thorough understanding of salivary gland physiology and pathology is crucial for proper diagnosis and management. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's symptoms and medical history, focusing on the specific function of the major salivary glands, recognizing that the parotid glands primarily secrete serous saliva, which contains enzymes like amylase for carbohydrate digestion, and that their dysfunction can lead to pain or swelling during mastication, is key. This aligns with best professional practice by directly linking the patient's reported discomfort during eating to the known function of the parotid glands. This approach is supported by the ethical principle of beneficence, ensuring the patient receives appropriate care based on accurate assessment, and by the professional standard of care, which mandates a comprehensive diagnostic process. Incorrect approaches analysis, focusing solely on the submandibular glands and their role in secreting both serous and mucous saliva, which contributes to lubrication and initial carbohydrate digestion, would be an incorrect approach if the patient's primary complaint is pain, specifically related to chewing. While submandibular glands are important, their primary dysfunction might manifest differently. This approach fails to prioritize the most likely gland involved based on the described symptom. Attributing the xerostomia solely to the sublingual glands, which primarily secrete mucous saliva and contribute to lubrication and taste, would also be an incorrect approach. Their dysfunction is less likely to cause the specific pain experienced during mastication as described. This overlooks the distinct functional roles of the different salivary glands. Considering only the minor salivary glands, which contribute to overall oral lubrication and are involved in taste, would be an incomplete approach. While their dysfunction can contribute to dry mouth, it is less likely to be the primary cause of pain specifically associated with the act of eating, which points towards the larger, more active major salivary glands. This approach fails to conduct a thorough differential diagnosis. Professional reasoning. Dental hygienists should employ a systematic decision-making process when faced with patient complaints like xerostomia. This process involves 1. Comprehensive patient history. Gathering detailed information about the onset, duration, and characteristics of the dry mouth, as well as any associated symptoms, medications, and medical conditions. 2. Physical examination. Performing a thorough oral examination, including assessment of salivary flow, mucosal integrity, and palpation of salivary glands. 3. Differential diagnosis. Considering all potential causes of xerostomia, including salivary gland dysfunction, systemic diseases, medications, and lifestyle factors. 4. Etiology-specific treatment planning. Based on the diagnosis, developing a treatment plan that addresses the underlying cause and provides symptomatic relief. This includes understanding the specific functions of the major and minor salivary glands to accurately pinpoint the source of the problem. 5. Patient education and follow-up. educating the patient about their condition, treatment plan, and the importance of regular follow-up. Question 8. Cost-benefit analysis shows that a thorough periodontal assessment, including precise probing depths, evaluation of mucogingival junction integrity, and assessment of furcation involvement, is essential for effective diagnosis and treatment planning. Considering the anatomical structures of the periodontium, which of the following approaches best reflects the dental hygienist's responsibility in identifying potential periodontal disease and guiding appropriate patient care? Option A. Performing a comprehensive periodontal charting that includes probing depths, mucogingival junction assessment, and furcation evaluation, correlating findings with anatomical landmarks. Option B. Focusing solely on supragingival calculus removal and ignoring subgingival conditions unless explicitly visible. Option C. Assuming the absence of significant periodontal disease based on the patient's age and a history of regular dental visits. Option D. Relying primarily on visual inspection of the gingival margin and patient-reported symptoms to gauge periodontal health. The correct answer is D. Relying primarily on visual inspection of the gingival margin and patient-reported symptoms to gauge periodontal health. Explanation. This scenario is professionally challenging because it requires the dental hygienist to integrate knowledge of periodontal anatomy with clinical assessment and patient management, all within the framework of established dental hygiene practice standards. The challenge lies in accurately interpreting subtle anatomical variations and their potential implications for periodontal health, while also considering the patient's overall oral hygiene and risk factors. Careful judgment is required to differentiate normal anatomical findings from those indicative of pathology, ensuring appropriate treatment planning and patient education. The correct approach represents best professional practice because it prioritizes a thorough and systematic assessment of the periodontal structures. This aligns with the fundamental principles of dental hygiene practice as outlined by the American Dental Hygienists Association, NBDHE, Standards of Professional Responsibility, and the Dental Hygiene Practice Act of the relevant U.S. jurisdiction. Specifically, it emphasizes the importance of accurate probing depths, mucogingival junction assessment, and evaluation of furcation involvement, all of which are critical for diagnosing and managing periodontal disease. This approach ensures that treatment is based on objective findings and patient-specific needs, promoting optimal oral health outcomes and adhering to the standard of care. An incorrect approach that relies solely on visual inspection without tactile assessment fails to meet the standard of care. Periodontal anatomy, particularly the depth of the sulcus and the presence of subgingival calculus or inflammation, cannot be accurately determined by visual inspection alone. This oversight could lead to underdiagnosis of periodontal disease, resulting in delayed or inadequate treatment, which is a violation of the dental hygienist's ethical and legal obligations to provide competent care. Furthermore, neglecting to assess mucogingival junctions or furcations, when indicated, represents a failure to perform a comprehensive periodontal assessment, potentially leading to misdiagnosis and inappropriate treatment planning. This can also be seen as a breach of the patient's right to informed consent, as they may not be fully aware of their oral health status. Another incorrect approach might involve making assumptions about the patient's periodontal health based on general demographic factors or previous treatment history, without a current, thorough clinical examination. While these factors can inform the assessment, they cannot replace the direct evaluation of the periodontal structures. This approach risks overlooking current disease activity or anatomical anomalies, leading to suboptimal care and potentially violating the principle of beneficence, which mandates acting in the patient's best interest. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather patient history and relevant information. 2. Conduct a comprehensive clinical examination, including visual and tactile assessment of all periodontal structures. 3. Integrate findings from the examination with patient history and risk factors. 4. Formulate a diagnosis and develop an individualized treatment plan. 5. Educate the patient about their condition and treatment options. 6. Document all findings and treatment provided. This framework ensures that decisions are evidence-based, patient-centered, and compliant with professional standards and legal requirements. Question 9. Analysis of a patient's medical history reveals a recent hospitalization for uncontrolled hypertension and a diagnosis of type 2 diabetes, both of which are managed by a primary care physician. The patient presents for a routine dental hygiene appointment with a chief complaint of mild gingival bleeding. Given this information, what is the most appropriate initial step for the dental hygienist to take to ensure safe and effective interprofessional collaboration in managing this patient's oral health needs? Option A. Perform a thorough oral examination and provide oral hygiene instructions, deferring any treatment that might be impacted by their medical conditions to the physician's discretion. Option B. Advise the patient to reschedule their appointment until their medical conditions are fully resolved and they are no longer under physician care. Option C. Initiate a consultation with the patient's primary care physician to discuss their current medical status, potential oral systemic links, and coordinate a safe and effective treatment plan for oral hygiene. Option D. Proceed with a standard periodontal assessment and cleaning, assuming the patient's medical conditions are stable and well managed based on their self-report. The correct answer is C. Initiate a consultation with the patient's primary care physician to discuss their current medical status, potential oral systemic links, and coordinate a safe and effective treatment plan for oral hygiene. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a patient with complex medical needs requiring coordinated care across multiple disciplines. The dental hygienist must navigate potential communication barriers, differing professional perspectives, and the patient's vulnerability to ensure their oral health needs are met without compromising their overall medical management. The risk assessment component highlights the need for proactive identification of potential complications and the development of a collaborative plan to mitigate them. Correct approach analysis. The correct approach emphasizes a proactive, patient-centered risk assessment that directly involves the interprofessional team. This aligns with the principles of collaborative practice and patient safety, which are foundational in healthcare regulations and ethical guidelines for dental hygienists. By initiating a discussion with the physician and other relevant healthcare providers, the dental hygienist demonstrates a commitment to understanding the patient's full health status, identifying potential oral systemic links, and developing a comprehensive care plan. This approach ensures that the patient receives safe, effective, and coordinated care, minimizing the risk of adverse events and optimizing treatment outcomes. It reflects the dental hygienist's responsibility to advocate for the patient and contribute to their overall well-being within the healthcare system. Incorrect approaches analysis. One incorrect approach involves proceeding with treatment without consulting the physician. Despite the patient's complex medical history and recent hospitalization, this failure to engage in interprofessional communication and risk assessment violates ethical obligations to patient safety and potentially regulatory requirements for coordinated care. It could lead to exacerbation of the patient's medical condition or complications from dental treatment, placing the patient at significant risk. Another incorrect approach is to solely rely on the patient's self-report of their medical status without seeking verification or additional information from the physician. While patient input is crucial, it is insufficient when dealing with complex medical histories and recent hospitalizations. This approach neglects the dental hygienist's professional responsibility to gather comprehensive information and conduct a thorough risk assessment, potentially leading to inappropriate treatment decisions. A third incorrect approach is to defer all decision-making regarding oral health to the physician. While collaboration is essential, the dental hygienist possesses specialized knowledge and skills in oral health. This approach undermines the dental hygienist's professional autonomy and expertise, failing to leverage their unique contribution to the patient's care. It also misses opportunities to identify and address oral health issues that may be contributing to or affected by the patient's medical condition. Professional reasoning. Professionals should utilize a systematic approach to interprofessional collaboration and risk assessment. This involves 1. Gathering comprehensive patient information, including medical history, current conditions, and recent healthcare encounters. 2. Identifying potential risks and complications related to the patient's oral health and overall medical status. 3. Initiating communication with other healthcare providers to share information, discuss concerns, and develop a unified care plan. 4. Documenting all assessments, communications, and treatment decisions. 5. Continuously reevaluating the patient's status and adjusting the care plan as needed. This framework ensures that patient care is safe, effective, and coordinated across all disciplines. Question 10. The monitoring system demonstrates that a patient scheduled for a routine prophylaxis has expressed significant anxiety about the procedure, specifically mentioning a past traumatic dental experience. The dentist has provided a standard treatment order for the prophylaxis. The dental hygienist is preparing the operatory and reviewing the patient's chart. Option A. Inform the patient that their anxiety is not a valid reason to alter the dentist's treatment plan and proceed with the standard prophylaxis. Option B. Proceed with the standard prophylaxis as ordered by the dentist, assuming the patient will manage their anxiety during the appointment. Option C. Immediately cancel the appointment and refer the patient to a mental health professional without consulting the dentist. Option D. Discuss the patient's expressed anxiety with the dentist. Explore potential modifications to the treatment approach to alleviate the anxiety, and document the conversation and any agreed-upon adjustments. The correct answer is D. Discuss the patient's expressed anxiety with the dentist, explore potential modifications to the treatment approach to alleviate the anxiety, and document the conversation and any agreed-upon adjustments. Explanation. This scenario is professionally challenging because it requires the dental hygienist to balance patient autonomy, the dentist's treatment plan, and their own professional judgment regarding the scope of practice and patient safety. The dental hygienist must act as a patient advocate while also adhering to established protocols and the dentist's directives. The correct approach represents best professional practice because it prioritizes patient well-being and informed consent, which are fundamental ethical and regulatory principles in dental hygiene. By communicating concerns directly to the dentist and documenting the discussion, the hygienist upholds their responsibility to advocate for the patient's oral health needs and ensures that any deviation from the standard of care is addressed collaboratively and transparently. This aligns with the NBDHE emphasis on professional judgment, ethical conduct, and patient-centered care as outlined in the Code of Ethics for Dental Hygienists and relevant state practice acts. An incorrect approach that involves proceeding with the treatment without further discussion with the dentist fails to uphold the hygienist's responsibility to advocate for the patient and may lead to inappropriate care. This could violate regulations regarding the scope of practice and the requirement for supervision or consultation with a dentist when necessary. Another incorrect approach, such as directly contradicting the dentist's instructions to the patient without prior consultation, undermines the dentist-patient relationship and the professional hierarchy, potentially leading to disciplinary action and a breach of professional conduct. A third incorrect approach, such as ignoring the patient's concerns and proceeding as planned, disregards patient autonomy and the ethical obligation to address patient-reported issues, which is a core tenet of patient-centered care. Professionals should use a decision-making framework that involves 1. Identifying the ethical and professional dilemma. 2. Gathering all relevant information, patient history, clinical findings, dentist orders. 3. Consulting relevant ethical codes, practice acts, and institutional policies. 4. Communicating concerns clearly and respectfully with the supervising dentist. 5. Documenting all communications and decisions. 6. Prioritizing patient safety and well-being. Question 11. Benchmark analysis indicates that a patient expresses a strong preference for a specific method of mixing a dental material, which differs from the manufacturer's recommended technique. The patient believes their preferred method will result in a better outcome. The dental hygienist is aware that the manufacturer's instructions are based on scientific evidence to ensure optimal material properties and longevity. What is the most appropriate course of action for the dental hygienist in this situation? Option A. Immediately proceed with the patient's preferred mixing method to avoid conflict and ensure patient satisfaction. Option B. Politely explain to the patient the importance of following the manufacturer's instructions for material manipulation to ensure the best clinical outcome and patient safety, and proceed with the recommended technique. Option C. Inform the patient that their preference cannot be accommodated and refuse to proceed with treatment without further discussion. Option D. Attempt to replicate the patient's preferred mixing method, assuming it might be a valid alternative technique. The correct answer is B. Politely explain to the patient the importance of following the manufacturer's instructions for material manipulation to ensure the best clinical outcome and patient safety, and proceed with the recommended technique. Explanation. This scenario presents a professional challenge because it involves a direct conflict between a patient's expressed preference and the dental hygienist's professional judgment regarding the appropriate handling of a dental material. The hygienist must balance patient autonomy with the responsibility to provide safe and effective care, adhering to established professional standards and regulatory guidelines. The core of the dilemma lies in ensuring the integrity and efficacy of the dental material while respecting the patient's wishes, which may stem from misinformation or a misunderstanding of the material's properties and application. The correct approach represents best professional practice because it prioritizes patient safety and the quality of care by ensuring the dental material is manipulated according to manufacturer instructions and accepted dental principles. This aligns with the NBDHE emphasis on evidence-based practice and the ethical obligation to provide competent care. By explaining the rationale behind the correct manipulation technique and offering alternatives if appropriate, the hygienist upholds the principle of informed consent and patient education, empowering the patient to make decisions based on accurate information. This approach also demonstrates adherence to the Dental Hygiene Practice Act and relevant state board regulations that govern the scope of practice and the standards for material handling. An incorrect approach that involves yielding to the patient's request without professional evaluation would be a failure to uphold the standard of care. This could lead to compromised treatment outcomes, potential harm to the patient, and a violation of the dental hygienist's duty to act in the patient's best interest. It would also disregard the manufacturer's instructions, which are often based on extensive research and are critical for achieving the desired clinical results and ensuring material longevity. Furthermore, such an approach could be seen as a breach of professional ethics, specifically the duty of beneficence and non-maleficence. Another incorrect approach, such as dismissing the patient's concern outright without explanation, demonstrates poor communication and a lack of respect for patient autonomy. While the hygienist's judgment is paramount, failing to engage the patient in a dialogue about their concerns and the rationale behind the recommended procedure can erode trust and lead to patient dissatisfaction. This approach neglects the ethical imperative to educate and involve the patient in their treatment decisions. A third incorrect approach, such as proceeding with the patient's requested manipulation without verifying its safety or efficacy, is negligent. This bypasses the critical step of professional assessment and could result in the use of a material in a manner that is detrimental to the patient's oral health or the success of the restoration. It represents a failure to exercise due diligence and adhere to established protocols for material handling, which are designed to prevent adverse outcomes. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and acknowledge the patient's concerns. Second, assess the validity of the patient's request in light of professional knowledge, manufacturer instructions, and clinical best practices. Third, clearly and empathetically explain the rationale behind the recommended procedure, including the potential risks and benefits of both the recommended and the patient's preferred methods. Fourth, explore alternative solutions that may address the patient's concerns while remaining within the bounds of safe and effective practice. Finally, document the discussion and the chosen course of action. Question 12. Research into a patient's request for a specific dental hygiene procedure that appears to fall outside the hygienist's authorized scope of practice, as outlined by the state's Dental Practice Act, presents a common ethical and legal dilemma. The patient is insistent, citing information they found online. The dental hygienist must decide how to proceed while ensuring patient safety and adhering to legal mandates. Which of the following represents the most appropriate course of action? Option A. Politely explain to the patient that the requested procedure is outside the hygienist's scope of practice according to state law and offer to discuss alternative, authorized treatments that can address their concerns. If the patient remains insistent and the procedure is clearly outside scope, consult with the supervising dentist for guidance on how to manage the situation and document the interaction. Option B. Perform the requested procedure as the patient insists, assuming that if the patient is requesting it, it must be appropriate and within the hygienist's ability to provide. Option C. Immediately refuse to perform the procedure and tell the patient that their request is inappropriate and that they should seek care elsewhere if they cannot accept the hygienist's judgment. Option D. Proceed with the requested procedure after a brief online search confirms that similar procedures are performed by other dental professionals, without consulting the supervising dentist or thoroughly explaining the legal limitations to the patient. The correct answer is A. Politely explain to the patient that the requested procedure is outside the hygienist's scope of practice, according to state law, and offer to discuss alternative, authorized treatments that can address their concerns. If the patient remains insistent and the procedure is clearly outside scope, consult with the supervising dentist for guidance on how to manage the situation and document the interaction. Explanation. This scenario is professionally challenging because it involves a direct conflict between a patient's expressed desire and the dental hygienist's professional judgment regarding the appropriate standard of care and legal limitations of their scope of practice. The dental hygienist must navigate the patient's autonomy while upholding their ethical and legal responsibilities to provide safe and effective care within the established regulatory framework of the NBDHE jurisdiction. The correct approach represents best professional practice because it prioritizes patient safety and adherence to the established scope of practice as defined by the relevant State Dental Practice Act and Board of Dentistry regulations. This approach involves open communication with the patient to understand their concerns, educating them on the risks and benefits of the proposed treatment versus alternative options, and consulting with the supervising dentist when the patient's request falls outside the hygienist's authorized procedures or when professional judgment dictates. This aligns with the ethical principles of beneficence, non-maleficence, and patient autonomy, while strictly adhering to legal mandates. An incorrect approach that involves performing the requested procedure without proper authorization or consultation would constitute a violation of the dental hygienist's scope of practice. This could lead to disciplinary action by the State Board of Dentistry, including fines, suspension, or revocation of licensure, as it directly contravenes the laws governing dental hygiene practice. Furthermore, it could result in patient harm and potential malpractice claims. Another incorrect approach, such as dismissing the patient's request outright without explanation or attempting to persuade them to accept a treatment they are uncomfortable with, fails to respect patient autonomy and can damage the patient-provider relationship. While the hygienist must operate within their scope, a complete disregard for the patient's wishes without a thorough explanation and exploration of alternatives is ethically problematic and may not represent the most effective communication strategy. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the patient's request and underlying concerns. 2. Determine if the request falls within the dental hygienist's authorized scope of practice according to state laws and regulations. 3. If the request is within scope but requires professional judgment, apply clinical knowledge and ethical principles. 4. If the request is outside scope or raises significant clinical concerns, communicate clearly and empathetically with the patient, explaining the limitations and rationale. 5. Consult with the supervising dentist for guidance and to determine appropriate next steps, which may include referral or alternative treatment planning. 6. Document all communication, assessments, and decisions thoroughly. Question 13. The evaluation methodology shows a patient presenting with generalized gingival inflammation, occasional bleeding upon probing in several quadrants, and probing depths ranging from 4-5 mm. The patient reports no significant pain or tooth mobility. Based on this information, which of the following diagnostic approaches is most appropriate for determining the patient's periodontal status? Option A. Rely solely on the reported probing depths of 4-5 mm to classify the condition as mild periodontitis. Option B. Conduct a comprehensive periodontal charting including probing depths, bleeding on probing, clinical attachment levels, mucogingival assessment, and furcation evaluation. Then correlate findings with the patient's history to establish a diagnosis. Option C. Focus exclusively on the presence of bleeding on probing as the primary indicator for treatment planning. Option D. Visually inspect the gingiva for signs of inflammation and assume the condition is gingivitis due to the absence of reported pain or mobility. The correct answer is B. Conduct a comprehensive periodontal charting including probing depths, bleeding on probing, clinical attachment levels, mucogingival assessment, and furcation evaluation. Then correlate findings with the patient's history to establish a diagnosis. Explanation. Scenario analysis. This scenario presents a common challenge in periodontal assessment where a patient exhibits signs and symptoms that could indicate a range of periodontal conditions, from gingivitis to more advanced periodontitis. The professional challenge lies in accurately differentiating these conditions to provide appropriate and evidence-based treatment. Misdiagnosis can lead to undertreatment, resulting in disease progression and potential tooth loss, or overtreatment, causing unnecessary patient anxiety and expense. The dental hygienist must employ a systematic and comprehensive assessment process that adheres to established diagnostic criteria and professional standards of care. Correct approach analysis. The correct approach involves a thorough clinical examination that includes probing depths, clinical attachment levels, bleeding on probing, suppuration, furcation involvement, mucogingival assessment, and evaluation of tooth mobility. This comprehensive data collection, when interpreted in conjunction with the patient's medical and dental history, allows for the accurate classification of the periodontal condition according to recognized diagnostic systems, such as the American Academy of Periodontology (AAP) classification. This systematic, evidence-based approach ensures that the diagnosis is accurate, leading to a tailored treatment plan that addresses the specific needs of the patient, aligning with the ethical obligation to provide competent and individualized care, as mandated by the Dental Hygiene Practice Act and professional codes of ethics. Incorrect approaches analysis, relying solely on visual inspection without objective measurements like probing depths and attachment levels, is a significant regulatory and ethical failure. This approach is subjective and prone to error, failing to meet the standard of care for periodontal assessment. It can lead to misclassification of disease severity, violating the principle of beneficence by not providing the most appropriate care. Diagnosing based solely on patient-reported symptoms without a thorough clinical examination is also professionally unacceptable. While patient history is crucial, it is not a substitute for objective clinical findings. This approach risks overlooking critical signs of periodontal disease, leading to delayed or incorrect diagnosis and treatment, which constitutes a breach of professional responsibility and potentially violates regulations requiring a comprehensive examination. Making a diagnosis based on a single parameter, such as only probing depths, is insufficient for accurate periodontal assessment. Periodontal disease is multifactorial, and a complete diagnosis requires evaluating multiple clinical indicators. This narrow focus can lead to an incomplete or inaccurate diagnosis, failing to identify all aspects of the disease and thus not providing optimal patient care, which is a failure to meet the expected standard of practice. Professional reasoning. The professional decision-making process for periodontal assessment begins with a thorough review of the patient's medical and dental history. This is followed by a systematic clinical examination, meticulously recording all relevant parameters, probing depths, bleeding on probing, clinical attachment levels, furcation involvement, mucogingival conditions, and tooth mobility. The collected data is then analyzed and interpreted in the context of established diagnostic criteria. This comprehensive approach ensures an accurate diagnosis, which forms the foundation for developing an effective and individualized treatment plan. This process is guided by the principles of patient-centered care, evidence-based practice, and adherence to the regulatory framework governing dental hygiene practice, ensuring both ethical conduct and professional competence. Question 14. Compliance review shows that a dental hygienist is considering the use of a newly available restorative material for a patient. The hygienist has heard positive feedback from a colleague about its aesthetic qualities and ease of use. What is the most appropriate course of action to ensure patient safety and adherence to professional standards? Option A. Consult the manufacturer's instructions for use and review current scientific literature regarding the material's biocompatibility and safety profile before incorporating it into patient care. Option B. Proceed with using the new material based on the positive anecdotal feedback from a colleague, assuming it is safe and effective. Option C. Prioritize the aesthetic benefits and ease of use of the new material, as these are likely to improve patient satisfaction over detailed safety investigations. Option D. Assume that all newly released dental materials have undergone sufficient testing and are safe for general use without further investigation. The correct answer is A. Consult the manufacturer's instructions for use and review current scientific literature regarding the material's biocompatibility and safety profile before incorporating it into patient care. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the dental hygienist to balance patient care with the responsible use of materials. The introduction of a new restorative material necessitates a thorough understanding of its biocompatibility and potential safety implications for the patient, as well as adherence to established professional standards and regulatory guidelines. The hygienist must critically evaluate information and make an informed decision that prioritizes patient well-being, while also considering the efficacy and safety of the chosen material. Correct approach analysis. The correct approach involves consulting the manufacturer's instructions for use (IFU) and relevant scientific literature to assess the biocompatibility and safety profile of the new restorative material. This aligns with the principles of evidence-based practice, which is a cornerstone of dental hygiene. The NBDHE emphasizes the importance of understanding material science and its application in patient care. By reviewing the IFU, the hygienist ensures they are using the material according to approved protocols, minimizing risks. Consulting scientific literature provides a broader understanding of the material's long-term effects, potential adverse reactions, and comparative safety data, thereby upholding the ethical obligation to provide safe and effective care. This proactive approach ensures that patient safety is paramount and that the chosen material meets established standards for biocompatibility and safety, as outlined by regulatory bodies governing dental materials in the United States. Incorrect approaches analysis. One incorrect approach is to proceed with using the new material based solely on a colleague's recommendation, without independent verification of its biocompatibility and safety. This bypasses the critical step of due diligence and relies on anecdotal evidence rather than established scientific and regulatory guidance. This failure to verify information could lead to the use of a material that has not been adequately tested or approved, potentially posing a risk to the patient and violating the principle of providing safe care as mandated by dental hygiene regulations. Another incorrect approach is to assume that all new dental materials are inherently safe and effective without specific investigation. This assumption disregards the rigorous testing and approval processes that materials undergo and the importance of understanding their specific properties. It represents a lapse in professional responsibility to critically evaluate the materials used in patient treatment, potentially exposing patients to unknown risks and failing to adhere to the standards of care expected in dental hygiene practice. A third incorrect approach is to prioritize the aesthetic or perceived cost-effectiveness of the new material over documented biocompatibility and safety data. While these factors may be considered, they should never supersede the primary responsibility to ensure patient safety. Making a decision based on these secondary factors, without a thorough understanding of the material's biological impact, is a direct violation of ethical and regulatory requirements that place patient well-being above all else. Professional reasoning. Professionals should adopt a systematic approach when evaluating new materials. This involves 1. Identifying the need or opportunity to use a new material. 2. Actively seeking out reliable information, including manufacturer IFUs, peer-reviewed scientific literature, and relevant professional guidelines. 3. Critically analyzing the gathered information, focusing on biocompatibility, efficacy, safety, and potential adverse effects. 4. Comparing the new material to existing proven options. 5. Making an informed decision based on the evidence, prioritizing patient safety and well-being. 6. Documenting the decision-making process and the rationale for material selection. This structured approach ensures that decisions are evidence-based, ethically sound, and compliant with regulatory standards. Question 15. Which approach would be most appropriate for a dental hygienist when a patient expresses a strong preference for a specific treatment modality that may not be the most evidence-based or clinically indicated option for their current oral health status? Option A. Implement the patient's preferred treatment without further discussion, assuming the patient has sufficient knowledge to make this decision. Option B. Proceed with the patient's preferred treatment modality immediately, as patient autonomy is the highest priority in all dental hygiene interactions. Option C. Inform the patient that their preferred treatment is not suitable and refuse to provide any treatment, recommending they seek care elsewhere. Option D. Conduct a thorough clinical assessment. Discuss the patient's preferences and concerns, present evidence-based treatment options with their respective risks and benefits, and collaboratively develop a treatment plan that respects patient autonomy while prioritizing optimal oral health outcomes. The correct answer is D. Conduct a thorough clinical assessment, discuss the patient's preferences and concerns, present evidence-based treatment options with their respective risks and benefits, and collaboratively develop a treatment plan that respects patient autonomy while prioritizing optimal oral health outcomes. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed desire and the dental hygienist's ethical and legal obligation to provide evidence-based, safe, and effective care. The dental hygienist must navigate the patient's autonomy while upholding professional standards and regulatory requirements. Careful judgment is required to balance patient preferences with the best interests of their oral health, ensuring that any treatment plan is both acceptable to the patient and aligns with established professional guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive assessment and informed consent process, which are cornerstones of ethical dental hygiene practice as mandated by the NBDHE regulatory framework. This approach involves gathering all necessary clinical data, considering the patient's medical history, and then engaging in a collaborative discussion with the patient. This ensures the patient understands their oral health status, the rationale behind recommended treatments, and potential alternatives, empowering them to make an informed decision. This aligns with the principle of patient autonomy and the dental hygienist's duty of care, as outlined in professional practice standards that emphasize patient-centered care and evidence-based decision-making. An incorrect approach that focuses solely on the patient's initial request without further assessment fails to meet the professional obligation to provide a thorough evaluation and evidence-based recommendations. This could lead to suboptimal treatment, potential harm, or failure to address underlying oral health issues, violating the duty of care and potentially contravening regulations that require competent and comprehensive patient management. Another incorrect approach that involves proceeding with a treatment that is not clinically indicated or is potentially harmful, even if requested by the patient, represents a significant ethical and regulatory failure. This disregards the dental hygienist's professional judgment and responsibility to act in the patient's best interest, potentially leading to malpractice and violating professional conduct codes that mandate safe and ethical practice. A third incorrect approach that involves dismissing the patient's concerns or preferences without adequate exploration and explanation is also professionally unacceptable. This undermines the patient-provider relationship, erodes trust, and fails to uphold the principle of shared decision-making, which is crucial for effective and ethical patient care. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough patient assessment, including medical history and oral examination. Second, identify the patient's chief complaint and understand their perspective and desires. Third, formulate evidence-based treatment options, considering their efficacy, safety, and potential risks and benefits. Fourth, communicate these findings and options clearly and comprehensively to the patient, addressing any questions or concerns. Fifth, engage in shared decision-making, respecting the patient's autonomy while guiding them towards the most appropriate and beneficial course of action within professional and regulatory boundaries. Question 16. The review process indicates that a patient presents for a routine dental hygiene recall appointment. The patient reports no specific oral discomfort, but expresses a desire for full mouth x-rays because they haven't had them in a while. The dental hygienist is considering the next steps in radiographic imaging. Which of the following approaches best aligns with the principles of dental radiography and regulatory guidelines for patient care? Option A. Evaluate the patient's current clinical condition and diagnostic needs to determine the most appropriate radiographic series, potentially including only specific periapical and biodoing radiographs if indicated. Option B. Take a full mouth series of radiographs to satisfy the patient's request and avoid potential dissatisfaction. Option C. Proceed with taking a complete series of intraoral radiographs as requested by the patient to ensure comprehensive diagnostic information. Option D. Explain to the patient that routine recall appointments do not typically require full mouth radiographs and offer to take only biodoing radiographs. The correct answer is C. Proceed with taking a complete series of intraoral radiographs as requested by the patient to ensure comprehensive diagnostic information. Explanation. This scenario presents a professional challenge because it requires the dental hygienist to balance the immediate need for diagnostic information with the ethical and regulatory obligation to minimize radiation exposure to the patient. The principle of ALARA, as low as reasonably achievable, is paramount in dental radiography, as mandated by federal and state regulations governing the use of ionizing radiation in healthcare. The dental hygienist must possess a thorough understanding of radiographic techniques, equipment, and patient factors to make informed decisions that optimize image quality while adhering to these standards. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic efficacy through a systematic and evidence-based decision-making process. This involves evaluating the clinical need for the radiograph, considering alternative diagnostic methods, and employing appropriate protective measures. Adherence to established protocols for exposure settings, film/sensor placement, and processing/digital acquisition ensures that the diagnostic information obtained is sufficient for treatment planning and evaluation, while minimizing unnecessary radiation. This aligns with the ethical duty of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. An incorrect approach that involves taking radiographs without a clear clinical indication or without considering patient-specific factors represents a failure to adhere to the ALARA principle. This can lead to unnecessary radiation exposure, violating federal and state regulations that mandate radiation protection for patients. Furthermore, it demonstrates a lack of professional judgment and a disregard for the ethical obligation to minimize harm. Another incorrect approach, such as failing to use appropriate collimation or lead shielding when indicated, also constitutes a regulatory and ethical violation, as these are standard protective measures designed to reduce scatter radiation and protect sensitive tissues. Finally, an approach that relies solely on patient request without independent clinical assessment fails to uphold the professional's responsibility to provide appropriate care based on their expertise and diagnostic needs, potentially leading to over- or underutilization of radiographic services. The professional decision-making process for similar situations should involve a thorough clinical assessment to determine the necessity of radiographic imaging. This includes reviewing the patient's history, current oral health status, and the specific diagnostic questions that need to be answered. The dental hygienist should then consider the most appropriate radiographic technique and equipment, ensuring it is properly maintained and calibrated. Patient-specific factors, such as age, medical history, and pregnancy status, must be taken into account to further tailor the exposure. Finally, all protective measures, including collimation, lead shielding, and appropriate exposure factors, should be implemented to ensure the ALARA principle is followed and the diagnostic quality of the image is maximized. Question 17. The analysis reveals that a dental hygienist is considering the use of a novel desensitizing agent that claims significantly faster onset of action and longer-lasting relief compared to traditional agents. This agent has received some positive anecdotal reports from colleagues, but has not yet been widely published in peer-reviewed journals or received an ADA seal of acceptance. The hygienist must determine the most appropriate course of action for patient care, strictly adhering to the regulatory framework for dental hygienists in the United States. Option A. Adopt the new desensitizing agent immediately, as the marketing materials highlight its innovative technology and potential to revolutionize patient care. Option B. Implement the new desensitizing agent for patients experiencing dental hypersensitivity, based on the promising anecdotal evidence and the potential for improved patient outcomes. Option C. Research the scientific literature for peer-reviewed studies on the new desensitizing agent's efficacy and safety. Consult with the supervising dentist regarding its appropriateness and the hygienist's scope of practice, and verify if it meets any relevant professional standards or guidelines before considering its use. Option D. Continue using the previously established desensitizing agents that have a proven track record and ADA seal of acceptance, as the new agent lacks sufficient independent validation. The correct answer is B. Implement the new desensitizing agent for patients experiencing dental hypersensitivity, based on the promising anecdotal evidence and the potential for improved patient outcomes. Explanation. The analysis reveals a scenario where a dental hygienist must integrate knowledge of recent advancements in dental materials into their clinical practice, adhering strictly to the regulatory framework governing dental hygiene in the United States, as defined by the NBDHE. This requires not only understanding the properties and applications of new materials, but also ensuring their use aligns with patient safety, efficacy, and established professional standards, all of which are implicitly or explicitly addressed by state dental boards and national accreditation bodies. The correct approach represents best professional practice because it prioritizes evidence-based decision-making and patient-centered care within the established legal and ethical boundaries of dental hygiene practice. This involves a thorough understanding of the material's properties, its approved indications, potential contraindications, and the hygienist's scope of practice as defined by state dental practice acts. Adherence to manufacturer instructions for use and consultation with the supervising dentist when necessary are critical components of responsible material selection and application, ensuring patient safety and optimal outcomes. This aligns with the overarching principles of professional responsibility and the duty to provide competent care, as expected by regulatory bodies like the American Dental Association, ADA, and state dental boards. An incorrect approach that involves adopting a new material solely based on marketing claims without independent verification or understanding its evidence base would represent a significant regulatory and ethical failure. This bypasses the requirement for evidence-based practice, potentially exposing patients to materials that are not proven safe or effective, or that fall outside the hygienist's authorized scope of practice. Another incorrect approach, such as using a material for an off-label indication without explicit dentist direction and informed patient consent, violates the principles of professional judgment and patient autonomy and could lead to adverse outcomes and professional disciplinary action. Furthermore, failing to stay current with advancements and their regulatory implications, thereby continuing to use outdated or less effective materials when superior, evidence-based alternatives are available, could be construed as a failure to provide the highest standard of care. Professional reasoning in such situations requires a systematic approach. First, the dental hygienist must identify the clinical need. Second, they should research available materials, prioritizing those supported by scientific evidence and approved by relevant regulatory bodies, e.g., ADA seal of acceptance. Third, they must assess the material's suitability for the specific patient, considering their oral health status, medical history, and any allergies. Fourth, the hygienist must confirm that the material and its application fall within their legal scope of practice and consult with the supervising dentist if there is any uncertainty, or if the material requires prescription or advanced procedures. Finally, they must ensure proper patient education and informed consent regarding the chosen material and procedure. Question 18. Strategic planning requires a dental hygienist to assess the suitability of various restorative materials for a patient presenting with a moderate carious lesion on a posterior tooth. The patient expresses a desire for a long-lasting, aesthetically pleasing, and biocompatible option. Considering the patient's oral hygiene habits and the lesion's location, what is the most appropriate approach for the dental hygienist to take in recommending a material? Option A. Recommend the most advanced and aesthetically superior material available, assuming it will provide the best long-term outcome regardless of patient-specific factors or cost. Option B. Select a universally accepted, cost-effective material that has proven durable in general practice, without extensively discussing alternative options or the patient's specific preferences. Option C. Advise the patient to consult with a general dentist for material selection, as this decision falls outside the scope of dental hygiene practice. Option D. Conduct a thorough risk assessment of the patient's oral health status, medical history, and lifestyle factors, and then present evidence-based options for restorative materials, discussing their properties, longevity, potential for adverse reactions, and cost-effectiveness, facilitating an informed patient decision. The correct answer is D. Conduct a thorough risk assessment of the patient's oral health status, medical history, and lifestyle factors, and then present evidence-based options for restorative materials, discussing their properties, longevity, potential for adverse reactions, and cost-effectiveness, facilitating an informed patient decision. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dental hygienist to balance patient autonomy and informed consent with the need to provide evidence-based care and adhere to professional standards regarding material selection. The hygienist must assess the patient's understanding of the risks and benefits of different restorative materials, while also considering the long-term prognosis and potential for adverse reaction, all within the scope of practice, defined by the NBDHE regulatory framework. Correct approach analysis. The correct approach involves a thorough risk assessment that prioritizes patient safety and informed consent. This aligns with the ethical principles of beneficence and autonomy, as well as regulatory requirements for patient education and documentation. The dental hygienist must evaluate the patient's oral health status, medical history, and lifestyle factors to determine the most appropriate and durable restorative material. This includes discussing the properties, longevity, potential for allergic reactions, and cost-effectiveness of various materials, ensuring the patient can make a truly informed decision. This approach is supported by the NBDHE emphasis on evidence-based practice and patient-centered care, which necessitates a comprehensive understanding of dental materials and their implications. Incorrect approach is analysis. One incorrect approach involves deferring the decision entirely to the patient without providing sufficient information or professional guidance. This fails to uphold the dental hygienist's responsibility to provide expert advice and ensure the patient understands the implications of their choice, potentially leading to suboptimal outcomes and violating the principle of beneficence. It also neglects the regulatory expectation for the hygienist to contribute to treatment planning based on their professional knowledge. Another incorrect approach is to unilaterally select the material based on personal preference or ease of use, without considering the patient's specific needs or preferences. This disregards patient autonomy and informed consent, which are fundamental ethical and regulatory requirements. Such an action could lead to patient dissatisfaction, material failure, and potential harm, contravening the NBDHE mandate for ethical conduct. A third incorrect approach is to recommend the most expensive material without a clear justification based on superior clinical outcomes for the patient's specific situation. This could be seen as a breach of trust and potentially violates ethical guidelines against financial impropriety or undue influence. The decision must be clinically driven and patient benefit oriented, not solely based on cost or perceived prestige of a material. Professional reasoning. Dental hygienists must employ a systematic decision-making process that begins with a comprehensive patient assessment. This includes gathering information about the patient's oral health, medical history, and personal circumstances. Following assessment, the hygienist should engage in shared decision-making with the patient, presenting evidence-based treatment options, including the types of dental materials available for the specific restorative need. This discussion should cover the advantages, disadvantages, longevity, aesthetics, and potential risks associated with each material. The hygienist's professional judgment, informed by their knowledge of dental materials and their application, is crucial in guiding the patient toward the most appropriate choice that aligns with their health goals and values, while adhering to all applicable regulations and ethical standards. Documentation of this process is essential. Question 19. The control framework reveals that a dental hygienist is treating a patient with moderate periodontitis who has shown gradual but consistent improvement with non-surgical periodontal therapy over the past 6 months. The patient, however, expresses significant impatience with the pace of healing and strongly requests to proceed with periodontal surgery immediately, believing it will yield faster results. What is the most ethically and professionally appropriate course of action for the dental hygienist? Option A. Insist that the patient continue with non-surgical therapy for an additional year, dismissing their concerns about the pace of healing to ensure complete resolution before considering any surgical options. Option B. Refer the patient to a periodontist for an immediate surgical consultation, without providing further education or discussion regarding the current treatment's progress or alternatives. Option C. Immediately schedule the patient for periodontal surgery as requested, prioritizing patient autonomy and their expressed desire for a quicker resolution. Option D. Thoroughly educate the patient on the benefits and risks of both continuing non-surgical therapy and proceeding with surgical intervention, facilitating a shared decision-making process based on comprehensive information and professional judgment. Correct answer is D. Thoroughly educate the patient on the benefits and risks of both continuing non-surgical therapy and proceeding with surgical intervention, facilitating a shared decision-making process based on comprehensive information and professional judgment. Explanation. The control framework reveals that a dental hygienist faces an ethical dilemma when a patient, who has been undergoing non-surgical periodontal therapy with consistent, albeit slow. Improvement expresses a strong desire to forego further treatment and opt for a more aggressive surgical approach due to perceived impatience with the current pace of healing. This scenario is professionally challenging because it requires balancing the patient's autonomy and expressed wishes with the hygienist's professional judgment, evidence-based practice, and the ethical obligation to provide the most appropriate and least invasive care. The hygienist must navigate the patient's emotional state and potential misunderstandings about periodontal disease progression and treatment outcomes. The correct approach represents best professional practice because it prioritizes patient education and shared decision-making within the established ethical and regulatory guidelines for dental hygiene practice in the United States. This involves thoroughly explaining the rationale behind the current non-surgical treatment plan, detailing the expected outcomes and timeline, and clearly outlining the risks, benefits, and alternatives of surgical intervention. By empowering the patient with comprehensive information, the hygienist facilitates an informed decision that aligns with the patient's values and the hygienist's professional responsibility to provide evidence-based care. This approach upholds the principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, autonomy, respecting the patient's right to self-determination, and justice, fairness in treatment. Adherence to the American Dental Hygienists Association (NBDHE) Code of Ethics and State Dental Practice Acts is paramount, ensuring that all actions are within the scope of practice and meet the standard of care. An incorrect approach that involves immediately agreeing to the patient's request for surgical intervention without adequate discussion or assessment would be professionally unacceptable. This failure would violate the principle of beneficence by potentially subjecting the patient to unnecessary and more invasive procedures, increasing risks without a clear indication. It would also disregard the hygienist's professional judgment and the evidence supporting the current treatment plan, potentially leading to suboptimal outcomes and violating the standard of care. Furthermore, it could be seen as a failure to uphold the patient's right to informed consent, as the patient would not have a complete understanding of all available options and their implications. Another incorrect approach would be to dismiss the patient's concerns and insist on continuing the current treatment without acknowledging their feelings or exploring the reasons for their impatience. This would disrespect the patient's autonomy and could damage the therapeutic relationship, leading to non-compliance or a breakdown in trust. Ethically, this approach fails to engage in shared decision-making and may not adequately address the patient's underlying anxieties or expectations, potentially leading to dissatisfaction and a negative perception of care. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the patient's current condition and response to treatment. 2. Actively listen to and acknowledge the patient's concerns, desires, and reasons for their request. 3. Educate the patient comprehensively about their periodontal health status, the rationale for the current treatment plan, expected outcomes, and the timeline for improvement. 4. Clearly explain the risks, benefits, and alternatives of surgical intervention, including the potential for complications and the recovery process. 5. Collaborate with the patient to develop a mutually agreeable treatment plan that respects their autonomy while adhering to professional standards and ethical obligations. 6. Document all discussions, patient education, and treatment decisions thoroughly. 7. Consult with the supervising dentist or other healthcare professionals if necessary. Question 20. During the evaluation of a new patient presenting with generalized, painless, erythematous lesions on the oral mucosa and a history of recent unexplained weight loss, which of the following actions best reflects the dental hygienist's professional responsibility within the NBDHE regulatory framework? Option A. Attempt to biopsy the lesions to obtain a definitive diagnosis before referring the patient. Option B. Advise the patient that the lesions are likely a minor irritation and recommend over-the-counter topical treatments. Option C. Document the findings thoroughly, educate the patient on basic oral hygiene, and schedule a routine follow-up appointment in 6 months. Option D. Immediately refer the patient to a physician for further medical evaluation, providing a detailed summary of oral findings and patient history. The correct answer is C. Document the findings thoroughly, educate the patient on basic oral hygiene, and schedule a routine follow-up appointment in 6 months. Explanation: this scenario is professionally challenging because it requires the dental hygienist to balance the immediate need for patient care with the broader public health implications of infectious diseases. The hygienist must act within the scope of practice defined by the NBDHE regulatory framework, which emphasizes patient safety, infection control, and adherence to reporting guidelines. The correct approach represents best professional practice because it prioritizes patient well-being through appropriate diagnostic and treatment measures, while simultaneously fulfilling legal and ethical obligations to protect the community. This aligns with the NBDHE emphasis on public health and the prevention of disease transmission. Specifically, it adheres to guidelines regarding the identification and management of potentially infectious conditions, ensuring that appropriate referrals and follow-up occur. An incorrect approach that involves ignoring the suspicious findings or delaying appropriate action would represent a failure to uphold the standard of care expected of a dental hygienist. This could lead to the progression of the disease in the patient, potential transmission to others, and a violation of professional ethics and potentially state dental practice acts that mandate reporting of certain conditions. Another incorrect approach, such as attempting to diagnose and treat a condition outside the scope of dental hygiene practice without proper referral, would also be a regulatory and ethical failure, potentially harming the patient and exposing the practitioner to liability. Professionals should use a decision-making framework that begins with thorough patient assessment, including a comprehensive medical and dental history and a detailed clinical examination. When suspicious findings arise, the next step is to consider differential diagnoses within the scope of dental hygiene. If the findings suggest a condition requiring medical intervention or further diagnostic testing beyond the hygienist's purview, the professional obligation is to communicate these concerns clearly to the patient and facilitate appropriate referral to a physician or specialist. This process ensures that patient care is comprehensive, safe, and compliant with all relevant regulations and ethical standards.